Well, hey guys, in today's video, I'm going to cover red light therapy for photo rejuvenation. That's going to be your anti-aging goals of improving skin tightness, laxity, firming up skin, and improving wrinkles. You all have asked me about this a fair number of times. Light therapy with red lights is done with LEDs. LED stands for light emitting diode. There are a variety of different LEDs that are used in skincare. I've talked about a few of them in other videos, including my review and usage of the iRestore professional hair device that I use. It uses LEDs to stimulate hair regrowth along with lasers. And I've also talked about it in my review of the Neutrogena light therapy mask. So check those videos out if you're interested in LEDs for hair loss and or acne. I talk about them in those videos. But for anti-aging purposes, we have quite a bit of evidence showing that red light therapy can exert some degree of skin tightening, improvement in skin firmness, and the improvement of wrinkles. The way that LEDs work in the treatment of skin diseases and exerting different changes in the skin that might be desirable is through something called photobiomodulation. Essentially, there are different things within our skin that can be excited by different wavelengths of the electromagnetic spectrum, whether that be visible light or ultraviolet radiation or even infrared radiation. Just looking at red light alone, there's one small study of only 23 people, and it looked at individuals getting red light therapy for 20 minutes 3 times a week. And in that study, they actually showed some notable changes in wrinkles, fine lines, smoothness, skin texture. There was another small study that combined both red light therapy as well as near-infrared therapy for the treatment of wrinkles around the eyes. And in that study, they alternated red light treatment with near-infrared treatment and showed there was an improvement in wrinkles around the eyes, an improvement in the skin texture around that area, and skin smoothness. And this was demonstrated out to, I believe, 29 days. So they looked at it for about a month. There was a double-blinded placebo-controlled study that actually looked at either infrared therapy alone, red light therapy alone, combination infrared and red therapy, or placebo. And in that study, they were looking obviously for photorejuvenation, and they showed an improvement in skin elasticity and in wrinkle severity. They also took imprints of the skin, and they showed, an improvement in wrinkle depth with both infrared treatment and red light treatment. In comparison to placebo treatment, showed 0 improvement. There was 0 change with placebo. But interestingly, they also looked at collagen in the skin, and they showed not only an improvement in collagen density and thickness, but importantly, the collagen was nicely structured and organized within the skin. That's important. You can have increased collagen and it be all abnormal, and that basically leads to, that's kind of, what underlies a lot of thick scars is an increase in abnormally oriented and shaped collagen. So you don't want that. This was nice, tight, well-structured, layered out collagen that you would want to see to yield a skin firming outcome. So they showed that with both infrared treatment and red light treatment. They didn't show it at all in the placebo, but now the near infrared treatment was superior to the red light treatment. And they obviously showed no change with the placebo, but the combination near infrared and red light together show the greatest outcomes and benefit in anti-aging. So seems as though a combination of near infrared and red LED treatment yields kind of the best as far as skin tightening, improving laxity. This is something that might be pursued, for example, if you have sagging in the neck, and it's nice in that it is non-invasive. You might not want to go through an invasive surgical procedure to lift the neck, in which case this is something that might help. If you have prominent wrinkles around the eyes, red light and near infrared therapy in combination in particular can help in rejuvenating that area, improving wrinkle depth and severity. This also could be used around the mouth for wrinkles around the mouth, just in spot focused areas where you have more prominent sagging and photo aging. The cheeks, the jowl area, you definitely can see some modest benefit with using a combination of near infrared and red light therapy. LED treatment with red and near infrared is, in contrast to other modalities, doesn't generate any heat in the skin, so it has a lower risk of adverse side effects like hyperpigmentation, for example. So it's pretty safe. Red light and near infrared light through LEDs can damage your eyes, so it's important that if you are using an at-home device that it be properly designed and equipped with eye protection in mind. So for example, the eye restore device that I use, not for photo rejuvenation purposes, but for hair regrowth, that device, as an example, will not activate if the device is not properly positioned on your head. The lights will not go, the LEDs will not go off. So it can definitely damage your eyes, but it's very safe otherwise at home. Who should not use LED-based treatments either at home or in an office setting? People with photosensitive diseases like lupus or polymorphous light eruption. Also, if you are taking a medication that makes you sensitive to light, you would not want to pursue this. It could be potentially cause a lot of problems for you and potentially be dangerous even. So always check with your treating healthcare provider as far as asking about your medications, if there's any contraindication. How do light-based treatments that you buy to use at home differ from those that you would receive in an office, in a dermatologist's office? The outputs are not as strong as what you would receive in a dermatologist's office. However, that doesn't mean they can't necessarily be effective. The problem is that you really don't have much of an objective way to know which devices sold for at-home use are better, are worth it, or the best. There's no kind of oversight and regulation as far as that goes. So for example, you can spend a lot of money on a device and it not be effective. Or you can get one that you think is a better value and maybe it's just not the output isn't very good. The NuFace Trinity, for example, is what, like $325? It's really pricey. And I believe that the newer iteration of that has a component of it that will do a combination of near infrared and red light. Something like the NuFace device, it's expensive. It just doesn't have the data behind it to make me convinced that it's going to be worth somebody's money for skin tightening and skin rejuvenation. The thing about red and near infrared photo rejuvenation is that you definitely have to do it on an ongoing basis to maintain those beneficial outcomes. And if you're not super aggressive with your sun protection, you're definitely going to be taking multiple steps back, because all of that collagen and whatnot they're trying to stimulate to come back and fill things in, it's just going to get destroyed by the sun. So you really have to be very diligent with sun protection. It has to be something you do on an ongoing basis. If you stop using a device like this, your skin will likely resume to kind of a baseline level. So it's not preventative, in other words, and it doesn't necessarily halt the aging process. Your skin will continue to age thereafter. So it seems as though it's something that needs to be done on an ongoing basis. But once you invest in it, maybe you're more likely to do it on an ongoing basis and to be motivated by it. So while these at-home devices don't have super strong outputs to give you the kind of outcome that you might get in an in-office treatment, I do think that for people who don't want to keep up with the office treatments can be really expensive, that maybe this is a logical investment for you. If you're someone, for example, who's using tretinoin. Tretinoin is a medication that can exert improvement in some of the visible signs of photoaging, but it's not going to necessarily change. It's not going to change really deep wrinkles. It's not going to get rid of those. So if you're using that, you're really diligent with your sun protection, and you just want more of a photo rejuvenation, maybe you even want kind of a subtle photo rejuvenation, like you're not looking for that facelift look, you just want a little bit more improvement, then I think it is reasonable to consider this device. I don't think it is that expensive in the long run if it's something that you are almost positive you're going to keep up with and do on a consistent basis. So, you know, whether or not that's going to be right for you, it's kind of a personal decision. If you think you're going to be able to keep up with it, I will tell you this, be prepared. The results are not going to be drastic. They're going to be modest, subtle. For some people though, that's actually what you want. That's some people's desire. They don't want a really heavily lifted look. They're not trying to look the way they did when they were a teenager. They just want a more refreshed look. And I definitely think that in that case, these devices might be something that you derive benefit from. It's just very hard for me to predict which ones work, given that there's no oversight or onus in terms of showing a specific outcome in a regulated way. But I do feel confident telling you guys, yeah, these things are safe and worth trying if you're willing to invest the money in. With the caveat that if you are on a photosensitizing medication or have a photosensitive disease, these are not going to be right for you. I don't think that this is going to protect you though from skin aging. So if you're somebody who's young and doesn't have any of these changes, this is not something that's necessarily going to be preventative. That's going to be your sun protection for sure. That's what you need to dial in now. So if you are like an adolescent or a young adult and you have no wrinkles or sagging skin, this is not something that's going to be prophylactic or preventative against that, and I don't think it's a good use of your resources. But that's everything I can tell you guys about red light therapy for photo rejuvenation. Comment below on if you use one of these devices, which one you used, and if you think it's been worth it. I would just love to hear your personal experiences. If you guys like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.